You're on whenever we're ready.
नमस्कार, ओम जय माता दी, जय श्री कृष्णा, जय संतोषी माता,
जय श्री कृष्ण, जय संतोषी माता।
आइए सीधा बैठिए। नेक्स्ट स्टेट स्पाइन स्ट्रेट, शोल्डर बिहाइंड, मन सहज, आंखें बंद, ध्यान मुद्रा में बैठ के लंबा गहरा सांस लेंगे नाक से और मुंह से 3 बार पवित्र नाम ओम का उच्चारण करेंगे। ओम भूर्भुवः स्वः तत्सवितुर्वरेण्यं भर्गो देवस्य धीमहि धियो यो न प्रचोदयात्। ओम भूर्भुवः स्वः तत्सवितुर्वरेण्यं भर्गो देवस्य धीमहि धियो यो न प्रचोदयात्। ओम भूर्भुवः स्वः तत्सवितुर्वरेण्यं भर्गो देवस्य धीमहि धियो यो न प्रचोदयात्। ओम सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामयाः, सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःख भाग् भवेत्। ओम शांति शांति शांति। Let's all pray to Almighty for the wellness of whole universe. Everybody should be healthy, wealthy, enjoy prosperity. Nobody should suffer from any ailment, whether that is physical, mental, spiritual, social, emotional, or financial. With these good thoughts, we'll start our session, keeping in mind all the precautions. Do as much your body allows you. Don't overdo it. Our technique is very, very simple, which is produced by our Pujniya Swamiji Maharaj. Swamiji, Namaskar, Namaskar, Namaskar. Bal Krishna Maharaj also. Very, very simple. Anybody can do it. But again, there are some things you have to keep in mind. Especially when you are doing the poses. If you are doing difficult poses which your body doesn't allow you, but you want to carry on, then you can get some side effects also. So that's why we have to regulate according to our physical and mental conditions. The yoga is done according to the even weather. When the weather is cold, we can do for a long time. But weather is very hot, we do for short time. Then again, depending upon your physical and mental conditions, there are certain poses which you are not supposed to do it. As we say, side by side, as we go along with the pranayama and the poses also, the asana. So always keep in mind, because we want to get the full benefit of this practice, which is so simple. Anybody can do it. Anybody can do it. Even the child. Our first breath is when we are born, isn't it? When the baby is born and he cries and everybody is happy and cheerful and giving बधाई to each one. बधाई हो, कन्या हो गई, पुत्र हो गया. और जब बच्चा नहीं रोता तो कितनी वरी हो जाती है. So first breath pranayama is started from the very breath, and according to our Rishi Muni Swamiji Maharaj, it should continue till the last breath. Pran Shakti. This is Pran Shakti is what is happening in Pran. When we are doing pranayama, two words everybody knows now, Pran and Ayam. Pran means life force or vital energy, which is prevailing all over the universe. We are getting from the universe all the time. And Ayam means how to regulate. First, you are doing expansion, deep breathing in, and then we are expanding to the whole body, because this pran is needed for everything. Even to just our food, we need the pran. जिन लोगों के प्राण ठीक नहीं चल रहा, उनको तो खाना भी नहीं पचता. कॉन्स्टिपेटेड है वो लोग, और लोग बल्चिंग उनको हो रही है, एसिड रिफ्लेक्स उनको हो रही है, प्राण जो काम नहीं ठीक कर रहा. तो प्राण इज very, very important. So keep in mind how we are breathing. Normally we breathe maybe 14 to 50 times per minute. But when we are doing deep breathing exercises, we reduce it to up to maybe 8 or maybe less. And if we are real yogi, like our Pujya Swamiji Ramdev Ji Maharaj, you may be breathing only maybe 3 to 4 times per minute. We are not supposed to do that. We haven't got that practice. We started this practice very late in the life. And so that's why it's showing now, what is the benefit? You know, in human body, there are 3 main organs. Anybody, you can open up and tell me. What are the 3 main organs in the body, in the human body?
What? Liver?
Acha, or kidney?
Yeah.
Very good.
Heart.
And the heart.
Heart, or
Lungs.
lungs. Very good. Or third thing.
Brain.
Brain.
You are very bright, my dear. भानु बहन, मैं नमस्कार करती हूँ आपको.
क्यों?
Very good, very good, very
Oh,
good. And I
thank
am
you.
coming to that point. There are 3 main organs in the body. They work together.
Okay.
And if one is not working, other won't work. Like we are walking hand in hand, 3 of our friends. And if we were like, I am very, balance is not very good, let's say. So I am holding your hand, 3 of us going on the road. And you know, Mrs. Kapur is, poor thing, mobility is not very good. So you're holding my hand. So 3 of us are going together, 3 of us. So we can work better. You can prevent my fall. Yes?
Yes.
Understand? You can prevent my fall. Same here. Heart, lungs, and the brain. They work together, And if one is not working, they will fail.
Okay.
Like if you leave my hand go, I will fall.
Cool. Yeah.
Same thing. When the heart is not working properly, lungs are not working properly, your brain won't be working. So by doing these breathing exercises, we are increasing the oxygen level, and which is going to our lungs. You know, most of the time we are doing shallow breathings. Yes? Shallow breathing. Yes, because nobody told us to take deep breath. It's not our fault. We didn't know. Now we know. So we are conscious. And we are taking deep breaths all the time now. Whatever we are doing. Go on deep breathing, deep breathing. And when you are not taking deep breathing, you are not using your lungs capacity in full. Because they say about these sacs are there in the lungs, you know, you see this, you're breathing from the nasal passage, then come your larynx, trachea, and then down bronchus, and then they're dividing into two lungs, you know. On the right side, there are 3 lobes, left side is 2 lobes because the heart has to get its place there. So you are breathing in, and they're small sponge-like honeycombs, you can say, from where the exchange of gases will be occurring. So we are breathing in, but if we are not doing deep breathing, the air can't reach to those sacs to do the interchange of gases. They are known as air sacs, and there's about 73 million air sacs in our lungs. But when we are doing the shallow breathing, we are using only 1/4 of our lung capacity. That's why our people are saying go on having deep breathing so that you can use all the air sacs properly to have exchange of gases. You get rid of your carbon dioxide and get in oxygen. Nature is very kind to us. Look at the nature, look at the sun, look at the air. They are giving us oxygen. What we are giving back to the nature? Anybody? What we are giving back to the nature?
Carbon dioxide.
Carbon dioxide toxins we are giving to the nature. That's what is happening, isn't it? Nature is giving us so much. Look at these trees, the flowers, the air, and our lovely sun, Surya Bhagwan. So what we are giving back? Toxins back to the nature. Even then they are happy. Even then they are happy. So the idea is go on having deep breathing so that you can use your lung power in full force. That is the basic. Now when the oxygen will, when our venous blood, bad blood go back to the heart and to the lungs, over there the exchange of gases occur and we get oxygenated blood. And that is coming back again to our heart, main vessel like aorta, which is a big one. And the below also, there are so many arteries, big one. And the blood is going to the whole body and that's going to supply it to every cell of our body. Same thing is going up to our brain. People suffering from dementia, why they are suffering? Lack of oxygen. They are not doing deep breathing exercises. Nobody told them. Now they are getting aware about this point. This is the thing, lack of oxygen that is killing our cells. They are killing our cells. That's why people are getting all this loss of memory, anger, depression, greed, all the negative things are coming in. So by doing pranayama, we are increased. What is pranayama? Anybody? How it is working? It's a fire. Pranayama is a fire. You know what fire does? If I put my gold earrings in the fire, what will happen? गंदगी निकल जाएगी और सोना चमकेगा. Yes? Follow my example. Like fire does to our gold, जितनी उसकी impurities है चली जाती हैं और अच्छा सोना आ जाता है. इसी प्रकार प्राणायाम करने से it's a fire. You are getting rid of all your toxins and you are getting better and you are so happy and cheerful, and other diseases we are getting rid of. Pranayama is the only way you can get rid of almost all the diseases, whether that is your physical is your diabetes, hypertension, low blood pressure, high blood pressure, thyroid problem, indigestion problem, then kidney problem, then that come under the heading of excretory program, then heart also, respiratory system. So every system we are getting rid of toxins. Plus, this breath is going to balance my mind and my body. That's what happens when we are doing pranayama. Plus, it stabilizes your temperature also. There are many more benefits by doing pranayama. Any disease, but again, we have to do for a long time. Most of the steps of the pranayama, and especially Bhadrika, number 1, Kapalbhati 2, third one is your Anulom Vilom. And if you are very tense personality, or you're having lots of problems like heart disease, high blood pressure, you can't sleep, then you are supposed to do, to balance this brain, the pituitary gland, which is a master gland, by doing, we do Bhamri, and then we do Udgir Pranayam. So depending upon your condition, you are spending more time on those steps of pranayam. If you've got thyroid problem, Kapal Bharti will help us, plus Ujjayi Pranayam. But we are not supposed to 1 or 2 times. You are supposed to do maybe starting 5 times, 10 times, 51 times. Go on doing this Ujjayi Pranayam. So you do according to your own problems. And otherwise, pranayam, what else is happening with pranayam? They say if you do pranayam regularly, doing the deep breathing exercises most of the time, you can live longer. This has been studied in various animals, birds. The people who breathe maybe 20 times or 18 times per minute, they are going to die early. So your lifespan is also increased by doing this pranayam. That's why they say you spend more time on pranayam. According to Swamiji Maharaj, he says 80% of the time should be spent on the pranayam. And you can pick and choose your own steps which your body requires. But Kapal Bharti, Bhadrika and Anulom Vilom, we should spend more time. So my friend, this is like I told you the physiology of these pranayam, why we are doing pranayam, why we are spending so much time. And the people who are doing this, they are getting the benefit. I will give you one example. During COVID period, most of the people were suffering from respiratory problems. And many were dying because of the pneumonia, because the virus goes into your lungs and ruin your lungs and you die of pneumonia. And other people now they are getting the side effect like pulmonary fibrosis. In the lungs there is a fibrous tissue that is getting very thick. Yes, and they are getting this. But again, the people who were doing this religiously, every day, pranayam, maybe 1 hour, 1.5 hours, 2 hours, they are much better because they are getting the report that their pulmonary fibrosis is not got worse in 2 years. There you are. These are the self-evidence I'm telling you. People are getting better by doing pranayama. We do physical exercises, that is also required to make our muscles strong, bones strong, and give us more stability, to make our balance better. We should do that also. And as I say, before doing pranayam, you have to make sure your body is fit to sit for a long time in any asana. Asana can be sitting on the chair like I am sitting, some of you are sitting, or some of you are on the mat, any asana. Anyway, whether sitting on the chair, on the sofa, or even in the bed, you can do it. Most of the things you can do in the bed. Your pranayam you can do, your exercises you can do, many soft, gentle exercises, and asana also. Markat asana you can do in your bed, no problem. So easy, raising your legs. So there is no excuse not to do it. Encourage everyone. Now we are taking too much from our environment, isn't it? Nature, प्रकृति से. तो हमें क्या करना है? हमें क्या करना है?
प्राणायाम
हमें स्प्रेड करना है. आप तो करना ही है, इसको स्प्रेड करो. और अगर मैं ठीक हो रही हूँ तो मेरी यही सेवा कि मैं दूसरों को भी ठीक करूं. यस, दिस वी कैन रिटर्न बैक टू आवर नेचर. हमें फायदा हुआ तो हम दूसरों. आप लोग तो आते हो, आई नो most of you are very regular, very punctual, come before time and listen very carefully. Thank you very much. And औरों को भी encourage करो ताकि Zoom का नंबर और बढ़ जाए. 100 से ऊपर चले जाए हम एक बार. 100 से ऊपर औरों को भी encourage करो. अपना टाइम है, करिए. तो ये हम नेचर को वापस दे सकते हैं. हम भी करें, औरों को करवाएं, बड़े प्यार से उनको समझा कर लाएं अपने साथ और जूम पे बैठाएं अपने सामने. चलिए अब कुछ करेंगे, सॉफ्ट जेंटल एक्सरसाइजेस. वेरी गुड फॉर द फिंगर्स. Most of the time we are getting lots of problem in our fingers. Grip is gone in the air, can't hold anything. Getting trigger fingers also. Carpal tunnel syndrome also is coming. Arthritis. खूब इसको मोड़ो, प्यार के साथ स्माइल करते हुए. Open up wide. Very good. Stretch your arms. Stretch. And go on breathing from the nostril in and out at your own pace. Slow, medium. Do it 2.5 seconds in and out, or maybe longer. 5 seconds. Why not? So you have started the first step of pranayama, known as Bhadrika Pranayama. Increasing our oxygen level, which is going to every cell of my body. मुट्ठी बनाइए आप, खोलिए, tight, tight. Then you can rotate. If there's any problem, just hold it. Give a support of other hand. आगे और पीछे. This is good for the problem here at the wrist joint, carpal tunnel syndrome. The people who use mobile for a long time, computer, iPad, they get all this. Then you can do both together. Close your eyes and feel where the effect is occurring. Whole upper arm up to your shoulder. Very good. Open hands again, wide, and rotate like this. Dancing pose. Now next again, pull it like this. Then down, up, down. Very good. Straighten your arms. Namaste mudra. Press it hard. You're touching the tip of your fingers and the thumb. Over there, your sinuses. All the sinuses are there. You are doing acupressure also. This is known as Anjali Mudra or Namaste Mudra, which is a sign we are respecting each other. We are bowing down to each other with due respect. Namaste, Anjali Mudra, plus pressing our hand very hard, doing acupressure. At the upper part, you are touching your sinuses. Then take it up slowly, very slowly. Go on breathing. Breathing is our adhar, the main base. Breathing in and out. Stretch. Stretch. Hold it. Do as much your body allows you. And bring it down slowly. Take long deep breath. Go on chanting inside. Om. 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 Breathe in, go up again. Now spread your arms sideways, slowly, 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 slowly. Hold it at the shoulder level, palm facing the ceiling. And you can do again same. Fingers are bending over. Very good. Bending over like this. Then open up and again do rotation at the wrist like this. Very good. Then up again, slowly. Now you can raise your head up. Also look at the ceiling. If there's a neck problem, please don't move your neck. Be gentle to yourself. Every day is different. Then look straight. Spreading the arms again. Coming at the shoulder level, stretch again, palm facing the ceiling. Now I'm going to do some bending also. My right arm is going towards the ground. The left one is going up. This is known as twist. Very good to get rid of extra weight on your waistline and good for your shoulders also. Keep your elbow straight if possible. Don't bend the elbow. And you can look down. Again, you're doing your neck movement. Look down at the ground. Dharti Mata ko dekhiye. Stay there for short time. Then come up very slowly. No jerks. Very slowly. Again at the shoulder level, both the arms. Stretch for the shoulder exercise, not to get frozen shoulder. This is sort of our treatment, therapeutic plus preventive, not to get frozen shoulder. Many people are suffering from frozen shoulder. That is again arthritis of your shoulder joint, which is more common in diabetics. Now, my right arm is going up toward the ceiling and the left one is going down towards the ground. And I'm bending over. Very good for your digestion also, because you're moving your stomach nicely. Get rid of constipation even. Movement of the bowel is occurring as we are bending. Weight reduction. So many benefits. Touch the ground if you can. Otherwise, stay at the level which is comfortable for you. Then come up slowly. At the shoulder level, both the arms. Very good. You are doing very well. Now you can cross over. Love yourself. Hug yourself. प्यार करो अपने से. इस शरीर से बहुत फायदा उठाना है. अगर ज्ञान ना होता तो कैसे करते प्राणायाम एक्सरसाइजेस? कैसे करते? Open up again. Love yourself. Well done. Again, take the arms on the side and we are jumping the rope. Rope jumping. ये जो steps हैं, they are increasing your nitric oxide, which we are talking so much nowadays. Nitric oxide, which is required to make me healthy and cheerful. वो सारा cover करते हैं nitric oxide. Your blood pressure is balanced. Your brain is balanced. Your digestive system is balanced. You won't get heart attack because of जब हो जाता है ना myocardial infection, क्योंकि वो क्लॉट जो आ जाता है वेसल्स में ब्लॉक करता है तो लोग मर जाते हैं फटाफट. Myocardial infarct. No infarcts. Nitric oxide is the one which we need by doing our various exercises and humming. You do every day. Every day. बैठे बैठे कर लो. Some exercises with the Bhadrika Pranayama. At your own pace, slow, medium, और कोई जवान है तो फास्ट भी कर सकता है. But control yourself. You are responsible. Whatever you do, you are responsible. That is my disclaimer on the Zoom. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. See? With short time, you are doing your cardiac work now. Respiration rate is gone up, pulse is gone up, which we need for the blood to circulate properly. Increase, slowly and slowly. Now, that last time we did some boxing. That's what we do in the morning now, boxing. Me and my son. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Carry on, carry on, carry on. Boxing. Very good. Mukka maar. Mukka maar, mukka. You get activated doing few times only. This boxing pose, you are taking actually Bhadrika Pranayama at a fast speed. Come on. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Down, down. How many exercises you are doing by doing this? You can create your own exercises. So easy. Mukka maar. Come on. Boxing. Come on. Come on. Carry on. You are all doing very well. Simple. Well done. Now we can relax. Now, after breathing for short time, your body will be just fit to do pranayama. Take long deep breaths. From the nostril, exhale from the mouth. That cools you down faster. So take your own time. Then start with the Bhadrika Pranayama again when the body is balanced Go on breathing from the nostril, exhaling from the mouth. Now please start Bhatrika Pranayam. We will be doing this minimum 3 minutes. Hands are in Dhyan Mudra. Keep your neck straight, spine straight, shoulder behind. Man Sahaj. Just concentrate on your body. Just think you are and your body is there with the pranayam. Nobody else is there. This is known as Dhyan Purvak Yoga. And the music will be going on with lovely bhajan from Swami Ramdev Ji Maharaj. So carry on, enjoy the bhajans also. Minimum 3 minutes. Then feel the difference. Feel the difference. Okay, keep your neck straight, spine straight, shoulder behind. Man sahaj, aankhein band.
हाँ नैना, हाँ बोल बोल.
शरण नहीं आवे हरि नारायण निर्गुण सरगुण हरि नारायण निर्गुण सरगुण सब ही में निर्गुण रंगी चादरिया रे थोड़ी थोड़े संत सुधा निर्गुण रंगी चादरिया रे कोई थोड़े संत सुधा कोई थोड़े संत सुधा कोई थोड़े संत सुधा निर्गुण रंगी चादरिया रे कोई थोड़े संत सुधा.
Raise your arms up, please. Rub your palms 15 to 20 times to generate heat. The Shakti. अंदर से मिल रही है सब, सब कुछ अंदर है, बाहर कुछ नहीं. योग is teaching us everything is in. बाहर बहुत घूम लिया. Then put the hand on your eyes. Feel the warmth going on your eyes and the rest parts of your face, giving us urja. Going to help with my eyes, getting rid of any burning sensation, discharge from the eye, the cataract, the glaucoma, or any other condition of the eye. लोगों की विजन बढ़ रही है ये करने से. सिंपल योगा टेक्निक्स. When the temperature of the hand is of the face, open your eyes very slowly, remove the hand, give a massage at the lower eyelids. We get black patches there and little bit swelling also at the lower eyelids. So many reasons for that. Then the lateral angle of the eye, very gently. Then the eyebrows, going to help me to increase the blood circulation of my eye muscles to make me better. ऐसे पिंच भी कर सकते हैं इसको, एक्यूप्रेशर कर रहे हो. Then the temple region, take away the stress. The forehead, you are getting rid of any tension or you are stimulating your sinuses there, known as frontal sinuses, over the head. Then come down the back of the neck, give a good massage there, especially there's a dimple here, press it, that one. Then come down, throat area, thyroid gland, slightly behind parathyroid gland, your vocal cords. You can do like this, behind, one hand in behind and one finger in front. Activating your lymphatic system also. So many glands are there behind the ear. Then you can do acupressure point on the ear. So many points are there, innumerable. Cough and cold, pain, bronchitis, arthritis, menopausal problems, anxiety, stress. Pull it nicely. First upper part, then middle part, then the lower part. Then rotate clockwise anti-clockwise. Then do the whole part of the ear. Inside, gently, into the canal also. Then outside, so many points. Whole body is there. And come down more at the thymus. That is important. The thymus point is very, very important. To get rid of bereavement, anxiety, increase the immunity to fight against any virus, bacteria, or fungus. It increases your immunity tolerance also. Tolerance. Press it nicely. We do tapping in various ways. I'm not going to touch that today. Time doesn't permit. So many techniques you can do to get active in short time. Okay. The second step known as Kapal Bhati. Again, there are two words as we all know. Kapal and Bhati. Kapal means forehead and Bhati means glow. As the name says, when we start doing this, do for 5 minutes. You will see glow on your face. No need to use any cosmetics to look more beautiful. The beautiful you will be by doing Kapal Bhati. People are not using many cosmetics. The people who are doing this yoga practice. I don't see them putting on those blushes now. No, they don't. Only they use aloe vera gel. And that is coming. And there is a special cream Swami has produced. Gold cream for the face, which is very effective. So Kapal Bhati we are going to do. The precautions are hypertensive, heart problems, severe acidity, severe asthma. They are supposed to do it, but they do it very slowly. If you're pregnant or trying to get pregnant, don't do it. If you're having menstruation, that menstrual period, don't do it. If you're any major surgery, don't do for 4 to 6 months. Even after minor surgery, please, when you start doing it, ask your yoga teacher or your physician which one to do it, how long to do it. Because sometimes even the simple operation, minor operation can have problems. So always keep in mind. That's why we sign for that every time. Whether that is minor or major surgery, the doctor makes you sign the signature so that if there's any side effects or any complications. So ask your yoga teacher which one to do it. But on the other side, I highly recommend, don't miss the classes. Come to the class, join with your friends on the Zoom, or even the sessions are open up now. Because you get a lot of vibrations from each other. Motivation comes from there, though you're just watching them. And Bhadrika Pranayama, of course, one can do slowly in any condition. That's what I encourage most of my participants to come to the class. Don't stop coming. Because when you stop coming, you get lazy. You don't feel like going again. So carry on in that routine. And meet your friends, cheer up, socialize, why not? In yoga, we are doing a lot of socialization. We are seeing each other. We are meeting each other every morning. Thank heavens to our Mr. Poddar. Thank you. Thank you very much once again. Opening up the Zoom and meeting our friends every day. And they are so cheerful. Come on, clap everybody. Everybody, everybody. Clap. We are lucky. Every day we are seeing each other. Yes, long distance. So credit goes to Mr. Poddar. Thank you, thank you, thank you. Okay, Kapal Bhati, 1 stroke, 1 second. Full attention is on exhaling. So there are 3 speeds again. For everything, there are 3 speeds. Slow, medium, and fast. But on the Zoom, please don't do it fast. Don't do it on the Zoom fast. Do according to your own system and your stamina. Okay. Now we will start sit straight. Keep your neck straight, spine straight, shoulder behind. मन सेट, आंखें बंद होंगी और साथ में भजन चलेंगे. Now mudras are very important. As we know, so many mudras have been taught by our friend Mr. Poddar. So you do according to your own conditions. Though running the class, I will be mentioning, but you can change yourself. What you require, what problem you are suffering. Okay, we'll start with the Pran Mudra. The powerful mudra is Pran Mudra. Touching the tip of your ring finger, the little finger with the thumb. Rest straight, 2 fingers. Put it on your knees. And start Kapal Bharti. 1 stroke, 1 second. Smile on the face. So many benefits are coming. Innumerable. Starting from your face, you start yourself. I have to go on talking. Start from your face. Glow is coming on the face. And we are going to activate all the organs on the face. Our eyes, our nose, our ear, our mouth. They are also getting the benefit. Because this is known as detoxifying pranayama. So toxins are all over. Every part we have got toxins. So toxins will be coming from all the parts. Then coming next to the major effect is on your thyroid gland, parathyroid gland. This will balance our thyroid gland and parathyroid gland if you are suffering from overactive or underactive. Major effect is here. Then on the heart and lungs, it is very effective for the respiratory system. Even the people who are suffering from asthma, they are encouraged to do this slowly and they are getting better. Already I've told you about pulmonary fibrosis because whatever I'm talking from my own experience. People are getting better with their bronchitis, pulmonary fibrosis, bronchiectasis, sarcoidosis, any disease of the lungs. Innumerable diseases are there in the lungs. You are getting better. But again, you have to do for a long time. Half an hour to 1 hour, doing 1 step of pranayama. You can interchange in between with Bhadrika and Anlom Vilom because sometimes we get bored doing one thing. We want change in life. Yes? So you can change over. Kapal Bharti to Anlom Vilom or to Bhadrika because our main object is to get the proper timing and proper technique. If technique is not right, you're not getting the benefit. And then come most important, your sankalp, Shudh sankalp. I am going to get better. I am going to get better. Positive thinking. People are getting better. We are also going to get better, provided we work hard to achieve that. So let's carry on with the Pran Mudra. 1 stroke, 1 second. Here, check your own technique. Put 1 hand underneath the nostril. Feel the warm air. I know most of you are very experienced, but I don't know if somebody new has come in the class. Check yourself. You are your own yoga teacher. Check yourself. If the warm air is coming out, that means fine. And put another hand on your abdomen because the major effect is on the abdominal organs. So hold this abdomen should be moving. The upper part, middle and the lower part because all organs are here. Here is your pancreas. For the diabetes, the liver on the right hand side underneath your rib cage and gallbladder underneath the liver. Same level your spleen and then whole digestive system, your stomach, duodenum, small intestine, large intestine, going down to your rectum and anus. The effect is going up to your anus. And the people who are suffering from hemorrhoids, they are getting better. Anal fissure, anal tag, they are getting better, which is quite common. If you suffer from constipation, these are the things, complication will come of this. Anal tag, anal fissure, even the rectal prolapse that is coming out. So it is going to make my digestive system better. Kapal Bharti is the one. That's why we do with the asanas also, Mandukasana. We'll be touching that also today. So carry on. Pran Mudra. It is going to improve my excretory system also. My kidneys will be functioning better. The next one is our Vayu Mudra. The tip of the index is touching the base of the thumb. Thumb is resting at the index finger. Vayu Mudra. To get rid of any type of arthritis or pain anywhere for any reason. Plus for the digestive system. As we are growing on younger and younger every day, I never say old, no, young. Our digestive system is not working at all because our Jaఠaragni is going down. So increase the Jaఠaragni to digest the food. Kapal Bharti is the best one. With the Vayu Mudra. At this age, golden age, there is only this big problem, Vata problem. See dosha in the body, when there is imbalance, we are labeled disease person. Vata is more problem at the old age, golden age. So this is going to help me to get rid of my arthritis and for my digestive system. Increase my Jaఠaragni. There are 13 types of Agni in the stomach. This is a major one. At the top of the list is Jaఠaragni. Next is Apan Mudra. Touching the tip of your middle finger and the ring finger tip of the thumb. You can do some exercises also because time is so limited, you know. So we are doing many things together. Now do your exercise. You can do your neck movement also. And you're moving all your upper part, the chest and the abdomen to get the benefit to activate those organs further. Kapal Bharti is going on. King of the pranayama is Kapal Bharti, detoxifying. Plus the mudra is also same, making my diabetes better, my liver better, my kidney better. So many actions are occurring one go. Apan mudra and detoxifying. Pranayama, Kapal Bharti. Well done. Next is Apan Vayu Mudra, double mudra. Vayu Mudra, Apan Mudra. We have done this. Vayu Mudra, Apan Mudra. So many benefits of this. Apan Vayu Mudra. Benefits of Apan Mudra and Vayu Mudra. Plus, this is very good if you are suffering from breathlessness, heart problem. If you do this mudra before start your walking, because walking is a must, but my body is so bad that having palpitation, breathlessness. So try to do this mudra before you go out for a walk or you're walking in your house. Or if you want to go up the stair to your bedroom, you're thinking 10 times whether I should go up or no, because I get breathlessness. Do this mudra for 5 to 7 minutes and the difference is there. And once you go up, then do it again, then come down. So this is the mudra for the heart and for the respiratory system, that is for breathlessness. Breathlessness, there's so many reasons why we get breathlessness. So many reasons. Kapal Bharti with Apan Vayu Mudra. Plus this lower your blood pressure also. But if you're suffering from hypertension, don't do Apan Mudra. It will increase the blood pressure. This lowers. This is the best mudra for at this age, because we are suffering from all those problems. Now, on the other side, many people are suffering from low blood pressure. People talk too much about hypertension, high blood pressure, but low blood pressure is much dangerous. If you suffer from that, many people die of that. And poor thing, they don't know even that is low blood pressure. So we do another mudra, Ling mudra, to increase our blood pressure, increase the body temperature also. Very easy. Close all the fingers. Just one thumb is up. Anyone, right or left? One thumb is up. Ling, ling. बोलिए शिव शंकर भोलेनाथ की जय. लिंग मुद्रा. Kapal Bharti with ling. The days you are feeling very cold, depressed, chill, which is very common at this age because many people are suffering from underactive thyroid gland, which is giving them this problem. To increase the body temperature. Good for the thyroid gland, parathyroid gland. Even for the speech also, because you need heat for that also. The vocal cords are going at this age. Heat is required to make every organ work better. Well done, my friend. There's so many mudras you can do with the Kapal Bharti. Now let's move over to our next step of pranayama, known as Bahari Pranayama, which is very, very important. But again, there are lots of precautions one has to keep in mind. If you are suffering from severe heart problem, hypertension, or hernia, make sure you don't do this. And Bahari Pranayama, you do with 3 locks. Neck lock is known as Jalandhar Bandh. Yes, but don't do it if you have got neck ache. And then come your Udyan Bandh, abdominal lock, and the third one is Mool one, the basal lock, base lock. Mool Bandh, we say Mool Bandh. Now we sit straight. Any mudra you can use here. I use Vayu mudra. Keep your neck straight, spine straight, shoulder behind. Breathe in from the nostril. Then exhale from the nostril fully. When you exhale, then you have the Mool Bandh first, that you are making your muscle below your navel very tight. We call it muscle that are sitting bone, you know, when we're sitting on those bones, they are muscles. They are elevated actually, according to medical term. You're making it tight. You're tight down below. Mool Bandh, Udyan Bandh. Now automatically come when you breathe out, as we do Kapal Bharti, you know. Breathe out, Udyan Bandh come. And then you can do the third one is Jalandhar Bandh. Bring your chin close to your chest. Here you are holding your breath. But as I said, if you got breathlessness or heart problem, you can't do it. So person should be okay from those angles to do this. And there's so many benefits because there's so many diseases in the body. I am activating this throat chakra, activating my thyroid gland, parathyroid gland, and then you are doing this one, Udyan Bandh, which is doing as Kapal Bharti, activating all the internal organs. The third one is very important, the Mool Bandh. Because at this age, many people are suffering from prolapse. The bladder prolapse, the rectal prolapse, anal tags are coming, uterine prolapse, and other thing is urinary problems are so common at this age. Unfortunately, women suffer more than men. Though he has got other problems of prostate, hypertrophy, you know, he is also suffering. So to avoid all those problems, plus you are losing weight because you are doing so much exercise of these organs and the muscles and the ligaments, you are losing weight. So we will do it only twice. Breathe in. Breathe out fully. Do the first block, second, third. Holding your breath comfortably. Can't hold anymore. Then open up first this one, Jalandhar Bandh, Udyan Bandh, number 2 and number 3. If you are suffering from urinary problems and fecal and urinary incontinence, try to do this third one for a long time, many times in the day. Like you want to go to toilet and the phone is ringing, we hold ourselves. We squeeze that lower part of our muscles, sitting bone muscles. Squeeze completely your sphincters down there. At the urinary end, you know, you are holding your sphincter tight so that there is no leakage. Try to do this many times in the day, and we have seen the effect. People are getting better with their incontinence and the urinary problems. This is very important for this age, you know, this was Mool Bandh is very important. You can do anytime, anywhere, even talking, I am doing it at the moment. Standing, you can do it. Lying down, you can do it. Sitting, you can do it. Watching television, you can do it. Try to do, increase the duration of these steps. That, as I mentioned from the very beginning, do according to your own problem. Okay. The next one is Agnisar Kriya. Again, we breathe in, breathe out fully, and we make our stomach go backward and forward fast. Same benefits as the previous one. Plus, you can lose more weight. So if you're overweight, try to do it many times. You can do 10 times, 20 times, 100 times, 200 times. Carry on. Carry on. This is known as Agnisar Kriya. This is an action. Coming to the fourth step of the pranayama known as Ujjayi pranayama, which is very, very important for the thyroid gland, parathyroid gland. Plus, it's good for your sleep apnea. This is known as an what we call snoring, anti-snoring pranayama. And it clears your voice. This is for the singers also. I call it singers pranayama. If you're going to sing somewhere, do this 4 to 5 times, make the difference in your voice. The voice is very, very harmonious, suswar. Open up your throat, completely vocal cords are activated. And this is good for to increase your metabolism because the thyroid gland is working better. You can lose weight also. This is even lowers your body temperature. If you're suffering from fever, the fever can come down. It works like Panadol. Yes. Good for heart and lungs. Again, for the face, It's anti-aging pranayama. Anti-snoring, anti-aging. Very easy to do it. Only technique should be proper. Which is state, hands any mudra. Going to breathe. When we breathe in, before that, either you can cough so that clear your passages and squeeze your neck muscles. Breathe in from the nostril, the sound will come like snoring sound. Because whole sound is coming from here, not from here. That is the difference. When we, in the beginning, as we don't know, we are breathing from here. No, you are breathing from your vocal cords, which are constricted. That's why snoring sound is coming. It's not a full sound, it's snoring sound. So whole is here. So that's what I say when you are in the beginning, when you're learning, put your hand there and feel. This is going up and down. That is vocal cord area, you know. You can feel that movement here. So we are breathing this part, not this upper part of our nasal passages. So breathe in. In the beginning, do short time, and then as you go on practicing, you can do longer. But don't make it too hard on your throat. Otherwise, you will get hoarseness of voice. Okay? Then bring your chin down. If there is no neck ache, here you are holding your breath. How long to hold depends on your practice or your condition. Can't hold anymore, then raise your chin up, look straight, close your right nostril with the right thumb, exhale from the left. Very, very simple. But don't do it too long, otherwise you might get hoarseness of voice. Slowly and slowly, we proceed with the Ujjayi Pranayama. Very, very important. I will tell you one history about this one. When we started 2005 with Swamiji, I think first 6 years, this pranayama wasn't in the list. We used to have 7 pranayama. Ujjayi was added later on. Maybe after 5 years, I joined in. 2005, you can say, around about 2008 or 9, he introduced this one. And this is very, very effective pranayama. Very, very effective. We used to have 7 steps of pranayama before. And then from that, it is 8 steps now. 8 steps of pranayama. This is a history about Ujjayi. Okay, the next one is Anulom Vilom. Very, very important pranayama. Balancing our brain and the whole body. Get rid of any problem anywhere. And get rid of the complications of our diseases like diabetes. We are getting effect on our eyes, blindness, retinopathy, as we say. Then our kidneys, nephropathy. Kidneys are not working. People are going on dialysis. And then neuropathy. All these pins and needle, burning of feet, as if the ants are coming on that. Can't sleep at night. Sometime we are putting our feet in, sometime out. So this is known as neuropathy, peripheral neuritis. There are so many reasons for that also. Maybe next week I will tell you one more condition where we are having all these problems also. Peripheral neuropathy. So complication, then complication of your hypertension, blindness again, kidney problem, stroke, paralysis. So this pranayama is covering everything. Activating our brain, Get rid of all the stress, anxiety, anger, greed, competition, ego, and sleeping better. Now doing Anulom Vilom and paralysis or any other central nervous system diseases. You start doing it. I will mention some more diseases like central nervous system, Parkinson, then motor neuron disease. They are all with the nerves. And then we all know about stroke, ataxia also, people having shakes, very imbalanced, cerebral palsy. These all problems are there. But if you do it, you can get better. People are getting better. We are seeing every day. But if you don't want to suffer, as a preventive method, Anulom Vilom, from the central nervous system, then good for the eyes, for the headache, any type of headache, do Anulom Vilom. You get better. Ear problem, tinnitus, there's no treatment for tinnitus in allopathy, no treatment. But they say, doctor, no, you have to live with it. Ignore. But yes, Swamiji has done a lot of work on that and people are getting better. Anulom Vilom is the best work for tinnitus. So one should do. And there are other things also one can do. Coming to your heart and lungs, lungs are getting strong by doing this pranayama. As we mentioned in the beginning, 3 major organs are working better: the heart, the lungs, and the brain by doing pranayama, because they work together as a friend, as a good friend, they work together. Then coming to your digestive system, that is getting on better. Then coming to excretory system, the kidneys, reproductive system. People are getting pregnant after 20 years of infertility. Just doing pranayama, some poses, looking at their diet, getting rid of their stress, anxiety. 10% of the people suffer from infertility because of stress, anxiety, because there's so much pressure from the family. 5 years married, haven't got children. What is the reason? Pressure of the family. Give you a lot of stress. So get rid of stress is the best, is pranayama. We cover most of the systems. Anulom Vilom. Balancing the Surya Nadi, alternating. Surya Nadi on the right, Chandra Nadi on the left. We are alternating and getting better, getting rid of extra fluid from the body also, production of good hormones, endorphins, take away our pain, and dopamine, serotonin, oxytocin, the loving hormones, everything you're getting from the Anulom Vilom. That's why we say practice this for long time, long time. Technique should be proper. Close your right nostril with the right thumb. Breathe in slowly, deeply from the left nostril. Then close the left nostril with these 2 fingers, the middle finger and the ring finger. Gentle pressure on the left nostril. Exhale from the right. Duration should be equal, but as you go on practicing, your duration of exhaling will increase a little bit longer. 5 seconds breathing in, then exhaling should be about 7 to 8 seconds. That comes with practice. So that you're throwing away all the carbon dioxide from the body. Then you're breathing again from the right nostril. Deep breath in. 2.5 seconds, 4, 5, 6, even you will be doing 7 seconds soon. Then close the right nostril, exhale from the left. This is one cycle of your Anulom Vilom. Always move your hands also, so that the hand should not stay in front of your nose. That carbon dioxide you are thrown out will go back again and give you complication of carbon dioxide toxicity. So one has to be very careful. Technique is most important. Technique, timing, and Shuddh Sankalp. Okay, let's move over to our next one is, which one? Bhamri. This we should spend more time on this to balance our brain, get rid of hypertension, heart problem, sleep better, any other problem. In the woman, menopausal problem. We'll do 3 times. Udgit Pranayama, chanting Om from the mouth after taking a long deep breath from the nostril 3 times. Hands are in Dhyan Mudra. Dhyan Mudra. Oh. Oh. The 8th step known as Pranayama. Prana means supreme power. Om. This is your silent meditation. We are chanting inside. Fix your mind either on your breath or the third eye, the Agya Chakra, and go on chanting inside. Whatever name you practice at home. And say inside, I am never alone. I am never alone. The supreme power is always with me. जो कुछ हो रहा है आपकी आज्ञा से हो रहा है, आपकी शक्ति से हो रहा है. मैं अकेला नहीं हूँ. We are thankful to Almighty who gave us strength to perform today's yoga. Thank you. Thank you. Thank you. Raise your arms up. Rub your palms. Put the palm on your eyes. Slowly open your eyes and remove the hand. देखिए 2-3 चीजें बड़ी इंपॉर्टेंट हैं लाइफ में. अगर आपके पास ज्यादा टाइम नहीं है, try to do at least 5 प्राणायाम and some आसन. इस उम्र में प्रॉब्लम वही है जो सबकी है. डायबिटीज, किडनीज काम नहीं कर रही, लिवर काम नहीं कर रहा. मंडूकासन एंड पवन मुक्त आसन. अगर आप ये भी कर लो दिन में 2-3 बार, but here you are not doing just quickly. No, you have to do maybe 1 minute, 2 minutes in one pose. Then only people are getting better. And do gentle exercises if body doesn't allow for other things. Pranayama is a must, and those 2 asanas. So we will do only Mandukasana as we are sitting here. Everybody knows make a fist. This is your Adi Mudra, the first mudra of life. Put it at the level of your navel. Breathe in, breathe out fully, then come down, look at the ground and look straight. And you can do Kapalbhati. We all are practicing now for a long time. But if you can't do Kapalbhati, please don't worry. Now here again, as the time is going on, as we said in the last year, that we are going to increase the duration. We are going to do this for a long time, maybe 1 minute. "40 times we were doing in the last year. I remember in December. So this year, as we made our pledge, we are going to increase, make it 60 times, 1 minute. And after 2 months, we will be doing 2 minutes each step. ठीक है, Mr. Porter? Sam?
40
2
times,
minutes.
40 times for prevention. And if you have diabetes, then longer.
तभी मैंने कहा आज 1 मिनट कर लो.
No,
2
40
महीने
बार,
में 2 मिनट करेंगे.
40
फिर
minutes is
उसके बाद 4th month we'll be doing for 5 minutes, then 10 minutes, end of the year.
that'll be too much for a lot of people. सबका राम नाम सत्य हो जाएगा.
नहीं 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 नहीं, ये बहुत strong है. Most of them are very strong, you know now. Anybody can run the session now, I think. They are so good.
Yes. Yesterday class was lovely with Champa ji, the class yesterday. Lovely class. For first time.
I'm saying anybody can do it. हो गया 60 times. Come on. Breathe in and come up slowly. Left hand at the navel, right at the top. Give a good squeeze. इससे stomach काफी control में आ जाता है. अच्छा इसको rub करो पहले. Breathe in. Breathe out fully. Go down slowly. Look at the ground and raise your head straight up. Doing Kapalbhati. Everyone is smiling. That's nice to know. Very good. Everyone is smiling.
पता नहीं हंस रहे हैं कि रो रहे हैं. पता नहीं.
नहीं जी, हंसने. Come up slowly. They are all smiling. आप negative क्यों कह रहे हो? रो रहे हंस रहे हैं लोग. Then on the side, for the liver and the gallbladder and the spleen to activate. And if you can go down well and good, otherwise stay sitting state. Kapalbhati. To activate my liver, not to get fatty liver, cirrhosis of liver, hepatitis, cancer. I'm getting enough bile from my bile, from the gallbladder. Spleen is activated. चलिए किडनीज को भी एक्टिवेट करिए थोड़ा. The level is from your umbilicus going back. वो कहते हैं किडनी को भूल मत जाना. याद रखो किडनी को सबसे ज्यादा यही दुखी करती है जब काम नहीं करती तो. वेल डन। चलिए अब थोड़ा लाफ्टर कर लेते हैं। टाइम डजंट परमिट टू डू एनीथिंग मोर। वेल डन, वेल डन, वेल डन। Singhasan, very important for my voice, anti-snoring. थायराइड को एक्टिवेट करना है। सिंहासन ट्वाइस। सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामयाः, सर्वे भद्राणि पश्यन्तु, मा कश्चित् दुःखभाग् भवेत्। ओम पूर्णिमः पूर्णात् पूर्णमुदच्यते पूर्णस्य पूर्णमादाय पूर्णमेवावशिष्यते। हरि ओम तत्सत्, हरि ओम तत्सत्, हरि ओम तत्सत्। ओम शांति शांति शांति। थैंक यू वेरी मच माय फ्रेंड्स।
Thank you, Dr.
Thank you,
Kapur.
Dr. Kapur.
Thank you.
Very nice.
Thank you, डॉक्टर साहब, बहुत अच्छा रहा, बहुत बढ़िया, फर्स्ट क्लास। थैंक यू।
डॉक्टर कपूर जी एक
Thank you,
गाना
Dr.
सुना दिया ना
Kapur.
लोहरी के ऊपर। लोहरी है तो गाना तो सुनाओ हमें।
गाना कौन सा सुनना है?
कल कल
लोहरी
प्रोग्राम
का
होगा।
कोई भी गाना सुना दो हमें।
कल होगा
हेलो, तालियां बजाओ, तालियां बजाओ।
बजा छोड़